Health Minister Dr. Frank Anthony, in response to calls from residents living in regions in proximity to Brazil, has noted the crisis faced by Guyana's neighbor to the south. As such, he noted that with the procurement of more COVID-19 vaccines, considerations will be given to extending the vaccination exercise beyond the elderly population and healthcare workers to residents of regions 8 and 9.
I think those two regions are a bit concerned because of their proximity to Brazil, and sometimes you have people coming across from Brazil who might not come through the official channels, so there's no way of knowing whether they have crossed over into Guyana. So that's something that we have to keep monitoring.
Efforts have since been made to intensify surveillance at the ports of entry.
We have set up a surveillance network in the Rupununi and in Region 8, so that to detect any persons that would cross, and based on that to also offer testing to them so that we can detect whether or not people are coming over, if they're positive and so forth. So that type of monitoring is going to continue because we're also trying to monitor to reduce the amount of people crossing.
Brazil has recorded more than 12 million COVID-19 cases since the start of the pandemic, with more than 53,000 new infections registered on Monday. Supplies to effectively manage patients diagnosed with the disease are running low, and some hospitals have indicated that they may be forced to take COVID-19 patients off their ventilators due to shortages in medicines used for intubation. Meanwhile, the local health minister also divulged that to date all of the healthcare workers in Region 9 have been vaccinated. In total, 20,470 Guyanese have been inoculated with either the Sinopharm or AstraZeneca vaccine. As new local COVID-19 infections hastily approach the 10,000 mark, Dr. Anthony noted that the public have become lax with following the COVID-19 precautionary measures, a practice he says will result in stricter enforcement of the emergency measures by the joint services.
I think you will see more people being charged for not wearing masks, and those businesses that are not complying with the guidelines, they will see stiffer penalties coming their way. All of this can be avoided if people do the right thing. We are all in this together.
The Ministry of Health has recorded an increase in the hospitalization of COVID-19 patients, both in the intensive care unit and in institutional isolation. There has also been a marked increase in deaths, with 21 persons having lost their lives for the month of March as of Tuesday, March 23rd. Temika Rodney reporting for the HGP Nightly News.